Bismillahirrahmanirrahim. Assalamu alaikum, dear students. This is probably our last lecture from the unit of renal physiology, and in this we are going to discuss the final topic of acid-base balance, in which I am going to tell you how to differentiate between different types of acidosis and alkalosis and see if they are compensated or not, and how to diagnose a condition which is given to you in the form of a scenario. And also we are going to discuss what is meant by anine gap. So let us dive into this very important topic and begin with different types of acidosis and alkalosis. Discuss what is meant by respiratory acidosis and what is a respiratory acid. So respiratory acidosis means increase of hydrogen ions in your body because of malfunctioning of your lungs, or when your lungs are diseased, or the cause of acidosis is your lungs. So as you already know that when your lungs are not functioning properly, your carbon dioxide cannot be blown off into the environment and it is retained in your body, and this carbon dioxide joins with water to form carbonic acid. So your carbonic acid is known as a respiratory acid or a volatile acid. Other than carbonic acid, all other acids are known as metabolic acids or fixed acids. So you have to remember what is respiratory or volatile acid and what is meant by metabolic or fixed acids. So only carbonic acid is an acid which is volatile, and it is because of retention of carbon dioxide or respiratory failure. That is why it is known as respiratory acid. And all other acids such as lactic acid and other acids in your body are metabolic acids, and the acidosis because of those acids is not respiratory in nature. So respiratory acidosis is caused by decreased rate of pulmonary ventilation, and this condition is known as respiratory acidosis. Whenever there is decreased ventilation, decreased carbon dioxide is going to be blown off and it is going to be retained in your blood, and increased carbon dioxide in the extracellular fluid is going to combine with water in the presence of carbonic anhydrase and form carbonic acid, and of course this is going to lead in increased concentration of hydrogen ions and a decrease in pH. This is known as respiratory acidosis. So what are the causes of respiratory acidosis? This can be due to damage to the respiratory center. It can be due to any obstruction in the respiratory center, like a foreign body stuck in your trachea or in your bronchial tree, or it can be due to any tumor. Another cause of respiratory acidosis is pneumonia, because in pneumonia your lungs are filled with water or fluid and there is not adequate exchange of gases between the blood and the alveoli. So this pneumonia can also lead to respiratory acidosis. And whenever there is destruction of pulmonary membrane and there is reduced surface area of the alveoli, this can also lead to respiratory acidosis, such as in case of emphysema or bronchiectasis or any other disease which can be due to smoking or any other hazard. So all of these conditions which disturb your respiratory system are going to lead to respiratory acidosis. Then there can be respiratory alkalosis. This is caused by increased rate of ventilation. So when your ventilatory rate increases and your rate of respiration increases, what you are doing is you are blowing off more than normal quantities of carbon dioxide, which is going to lead to decreased carbon dioxide in your extracellular fluid, and your carbonic acid concentration is going to fall way below than normal ranges. This is going to reduce hydrogen ion concentration and increase your pH, and this is going to result in respiratory alkalosis. So what are the causes of respiratory alkalosis? One of the most important causes is psychoneurosis, or you can call it hysteria. So when some person is hysterical, what they do is they start to breathe at a greater rate than normal, and what they do is they are blowing off their carbon dioxide, and this is going to result in respiratory alkalosis. So how do you treat these people? It is very common, and you can see it in cartoons and in movies, that they are given a paper bag and they are asked to breathe in a paper bag, so that when they breathe in this paper bag, they are going to throw their carbon dioxide in, and then they re-inhale it, and then again throw carbon dioxide into the bag, and again re-inhale this carbon dioxide, so that too much carbon dioxide is not lost from the body. So this is just some important interesting, in fact, information, that how to treat hysterical respiratory alkalosis or psychoneurosis caused overbreathing. Also, hypoxia at high altitude leads to alkalosis, because at higher altitude there is hypoxia, there is reduced oxygen in the atmosphere, which prompts your respiratory center to increase the respiratory rate, and when your respiratory rate is increased, you blow off excess carbon dioxide, which results in alkalosis. Next, we have the metabolic acidosis. This means when acids are increased within your body, but the acids which are increased are not carbonic acid. In fact, there are other acids which are not involved with your respiration. So what happens is, now the cause of acidosis are not your lungs. Your lungs are absolutely fine, and the acid which is increasing is not carbonic acid, it is some other acid such as lactic acid. This can be due to multiple causes, such as your kidney failures, and your kidney is not functioning properly, and it is not throwing out enough hydrogen ions, and these hydrogen ions are being retained within your body. It can also be due to excess metabolic acids, such as when too much exercise or too much metabolism in your body leads to formation of large quantities of lactic acid. It can also be due to administration of any drug or any metabolic acid through your veins. If you inject some acid into a person's body, or some drug that causes acidosis. Other than that, there can be excess absorption of acids from the GIT, or another important function is loss of base from the body. If you start losing bases, bicarb ions, from your body, this is also going to disturb the balance, and your hydrogen ions are going to be in greater concentration as compared to the bicarb ions. So when are you going to label the condition metabolic acidosis? Whenever there is increased hydrogen ions, or or when there are decreased bicarb ions. So the conditions in which your hydrogen ions are increased include your kidney failure, or when you have excess metabolic acids being formed in your body, or when you ingest an acid, or you are administered an acid through IV or intravenous route, or when too much acid is being absorbed from your gut, or when there are bases being lost from your body. So very important example of bases being lost from your body is diarrhea. Do you know, when you have diarrhea, a lot of bicarb is lost from your GIT, and this loss of bicarb in the form of loose stools leads to metabolic acidosis. So this is a very important MCQ point, that which of the following is going to cause metabolic acidosis, and you are given a scenario of diarrhea. So remember that diarrhea causes metabolic acidosis, because bicarb ions are being lost from your gut, and there are not enough bicarb ions left in your body to balance out the hydrogen ions, and this is going to lead to metabolic acidosis. This is very important from MCQ and even SCQ point of view. And the conditions, as I mentioned before, are diarrhea, very important. ठीक है, 3 stars with diarrhea, because this is often given as a scenario for metabolic acidosis. Also, deeper GIT vomitings. There are two kinds of vomitings. One in which you vomit out the contents of your stomach. When you vomit out the contents of your stomach, what you are doing is you are losing your HCl from your stomach, and when this HCl is lost, this is going to result in alkalosis. So we are not talking about your GIT or stomach vomiting. We are talking about deeper GIT vomiting, which means vomiting of deeper GIT contents such as your duodenal contents. If you have deep GIT vomiting from your duodenum, you are going to lose a lot of bicarb ions which were added in your duodenum by the pancreas and the gallbladder. So this deeper GIT vomiting is going to result in alkalosis. Please do remember, if vomiting is being mentioned, please confirm which kind of vomiting they are asking. If they are asking vomiting from stomach, then it is common sense that if you vomit the contents of your stomach is full of HCl for digestion purposes, and if you lose this HCl, there is going to be reduced acid in your body, and the condition you will be suffering from is known as alkalosis. But if you have deep GIT vomiting, which means that the contents are beyond your stomach, from your duodenum and other parts of your small intestine, so remember that in your duodenum large quantities of bicarb are being added by your pancreas and by your gallbladder, and when you have deep GIT is going to result in metabolic acidosis. So other causes for metabolic acidosis are uremia, diabetes mellitus, and any inhibitor of the enzyme carbonic anhydrase such as acetazolamide, lactic acidosis, and salicylate overdose. So drugs such as the salicylates are also responsible for metabolic acidosis. Next we have the metabolic alkalosis, in which the metabolic or fixed acids, that is all the acids other than the carbonic acid, if any one of them is decreased, this is going to result in metabolic alkalosis. So the causes for metabolic alkalosis are all the diuretics except carbonic anhydrase inhibitors, because carbonic anhydrase inhibitors cause metabolic acidosis, not metabolic alkalosis, and all of the other diuretics cause metabolic alkalosis because diuretics cause excretion of sodium from your body along with hydrogen ions. So other than the diuretics, any excessive ingestion of alkaline drugs such as antacids. Antacids are the drugs which are used in case of acidity, when you have increased production of HCl in your stomach and you start feeling heartburn, you take some drugs known as antacids. So excess antacids can also lead to metabolic alkalosis. Also loss of hydrogen ions due to gastric vomiting. This is very important. You might be given a scenario of a person who is having severe vomiting, and this vomiting is gastric in nature, and you will be asked to describe what kind of what kind of acid base disorder this person is suffering from, and then you will have to mention that this is metabolic alkalosis, because in case of gastric vomiting you lose a lot of HCl. Another cause of metabolic alkalosis is damage to the damage to renal tubules, or any other condition leading to excess hydrogen loss from the renal tubule, and one of the hormones is also responsible for this, that is aldosterone. So what aldosterone does, is it causes reabsorption of sodium, and as you know that sodium and hydrogen ions are counter transported. So when aldosterone causes a lot of reabsorption of sodium, it is also going to result in a lot of excretion of hydrogen ions from your. So let us now move on to the most important part of this unit, and part from which most of your questions are asked. So you are given a scenario of acid base disturbances, and you are asked to diagnose the disturbance, whether it is acidosis or alkalosis, what kind of acidosis or alkalosis it is, and whether it is compensated or not. So I am going to walk you through step by step as to how to diagnose the acid base disturbances, so that you can attempt any MCQ or SCQ that is given to you. So let us begin. First, you must know the steps of acid-base disturbance diagnosis. First, what you need to determine is whether it is acidosis or alkalosis. So, you are going to be given a pH, and from that pH, you have to determine whether this is acidosis or alkalosis. Secondly, what you need to determine is, after you have determined whether it is acidosis or alkalosis, now you have to determine the type of disorder. If it is acidosis, so either is it metabolic acidosis or is it respiratory acidosis, or if it is alkalosis, either it is metabolic or renal. Once you have determined whether it is metabolic or renal disturbance, then you are going to see if it is compensated or not. As I mentioned before that whenever the acid base disturbance is because of lungs, that is, it is of respiratory causes, the compensation is going to be carried out by the kidneys. And whenever the acid base disturbance is because of the kidneys, your lungs are going to compensate for it, and this is how you are going to see if it is compensated or not. So these are the three steps of solving the scenario given to you about acid base disturbance. So before we start step by step discussing how to diagnose such scenarios, I need you to remember some important points. First, you must know what is the normal value of pH. So the normal value of pH is around 7.35 to 7.45. Any value less than 7.35 is known as acidosis, and any value greater than 7.45 is known as alkalosis. Next, you need to know that the partial pressure of carbon dioxide in your blood is around 35 to 45 millimeter mercury. So this is the normal range. You have to remember the range of all of these parameters, otherwise you won't be able to solve these questions. So partial pressure of carbon dioxide greater than 45 will cause acidosis, and the partial pressure of carbon dioxide less than 35 is going to cause alkalosis. That is quite simple. If the carbon dioxide in your blood is increasing, as I told you before, that carbon dioxide is synonymous to or can be a direct indicator of concentration of hydrogen ions, because carbon dioxide is interchangeable with carbonic acid. So the greater the carbon dioxide concentration, greater will be the carbonic acid concentration, and there will be a greater hydrogen ion concentration. So whenever your carbon dioxide partial pressure increases more than 45 millimeter mercury, it is going to cause acidosis, and when it reduces less than 35 millimeter mercury, it is going to cause alkalosis. Third value you must remember is that of the bicarb in your blood. Sorry, this is not the right unit for it. So it is given in equivalents per liter, and bicarb, if it is greater than 28 equivalents per liter, it is going to cause alkalosis, and if it is less than 22 equivalents per liter, it is going to cause acidosis. So you have to remember this, that bicarb which is present in your blood must balance out the hydrogen ions, and when it is in a range of 22 to 28 equivalents per liter, it is going to be a normal state. But if your bicarb ions are less than 22 equivalents per liter, this means that the patient is suffering from acidosis, because there are too little bicarb ions to balance out the hydrogen ions in the body. So this is known as metabolic acidosis. And when your bicarb ions increase to a value greater than 28 equivalents per liter, this means that their quantity is so large that they can cause metabolic alkalosis. So please remember all of these values. Next you need to remember is that all the renal disturbances are compensated by the lungs, and all the respiratory disturbances are compensated by the liver. So if you remember all of these points, the diagnosis for acid based diseases is going to be very easy for you. So please take some time, pause this video, and remember these values. Try to learn these values so that you can easily diagnose acid based disturbances. Now moving on, I am going to tell you how to diagnose a scenario for acid based disturbances. You are going to be given three values. One is going to be the value of pH, which is going to tell you whether it is acidosis or alkalosis, and you are going to be given the value of partial pressure of carbon dioxide and the concentration of bicarb ions in your blood. So with the help of these three values, you are going to determine what kind of disturbance this is, what is the cause of the disturbance, and whether it is compensated or not. And remember that most of the time, especially for BDS students, they are going to give you some scenarios which are going to hint towards the diagnosis, such as they are going to tell you the patient is suffering from vomiting, and as I mentioned before, that if they mention vomiting, this means that the contents of the stomach are being vomited out, and HCl is being lost. So you can immediately understand that, oh, this is metabolic alkalosis because acid is being lost from the body. Then if you are given a scenario of diarrhea, you will immediately understand that since bicarbs are being lost from the body, so oh, this is alkalosis, and since lungs are not involved, this is metabolic alkalosis. Then you can be given a scenario that a person who is smoker and is suffering from COPD, then you can immediately understand, oh, this person might be suffering from a respiratory acidosis because his lungs are not working properly and he's not blowing off carbon dioxide. So there might be some hints in your question, but if unfortunately such scenarios are not given and you are just presented with numerical values, then you will have to look at these values very carefully to determine what kind of disturbance this person is suffering from. So let me guide you how to determine the diagnosis or make a diagnosis just solely depending upon the values. So what I have done is I have placed a little cheat sheet over here so that you can look at the normal values of different parameters, and this is going to help you in diagnosing the scenario which is being given to you. So let us begin. First of all, when a scenario is given to you, please look at the pH. There is going to be given a value of pH, and immediately when you look at the pH, you are going to understand what kind of a disorder this is, and that is when half of your work is done. Suppose the pH which is given to you is less than 7.35, you're immediately going to understand, oh, this person is suffering from acidosis. So now you know half of your answer. You know this person is suffering from acidosis. The only thing that is left to determine is what kind of acidosis. So write half of your answer at the side of your paper and you will understand that this person is suffering from acidosis. But if the pH which is given to you is greater than 7.45, you are going to immediately understand that this person is suffering from alkalosis. So half of your work is done. But what kind of acidosis or alkalosis is that person suffering from? For that, you have to determine the values of the partial pressure of carbon dioxide and the values of bicarb ions. So let us first take the scenario of acidosis. Suppose in scenario 1, a person was having arterial pH of less than 7.35. You will immediately understand that this person is suffering from acidosis. Now forget about alkalosis. You know that your answer is some kind of acidosis. To determine which kind of acidosis this is, look at the partial pressure of carbon dioxide and the values of bicarbs in the blood. So before we move on, what do you think is going to happen in acidosis? Acidosis can be either due to respiratory cause or it can be due to renal cause. If the cause is respiratory, Then how can lungs cause acidosis? Of course, lungs are going to cause acidosis if they are not working properly and they are retaining carbon dioxide. When the carbon dioxide is retained within your blood, the partial pressure of carbon dioxide will increase, and then it is going to convert into carbonic acid and dissociate into hydrogen ions and reducing your pH. So first, if your partial pressure of carbon dioxide is increased, you will immediately understand that this person is suffering from respiratory acidosis. And then what can be the other causes of acidosis other than the respiration? So the metabolic acidosis is either caused by decreased bicarb ions or increased hydrogen ions, but mostly you are given the concentration of bicarb ions. So understand that whenever your bicarb ions are reduced and their value is less than 22 milliequivalents per liter, then you will understand that this person is suffering from metabolic acidosis. So we have two scenarios of acidosis. Either the partial pressure of carbon dioxide is increased, then this person will be suffering from respiratory acidosis, or the concentration of bicarbs is decreased and this person is going to be suffering from metabolic acidosis. So let us see how the flow chart is going to move on with the help of values. First, go for the value of bicarb, and if the value of bicarb is less than 22, immediately label it off as metabolic acidosis. But if you see that the value of bicarb is either normal or even slightly increased, then you must understand that this is not metabolic acidosis. Then close your eyes and immediately write your answer as respiratory acidosis, because there is no third option. Acidosis can be either metabolic acidosis or respiratory acidosis. If your bicarbs are not reduced, then it is understood that this is not metabolic acidosis and it is respiratory acidosis. And then to confirm your answer, look at the value of partial pressure of carbon dioxide, and it would be greater or increased than 45 millimeter mercury, and you will immediately understand that something is wrong with the lungs. They are retaining carbon dioxide, and this carbon dioxide is increasing the pH, decreasing the pH of the blood. So you can immediately write your answer as respiratory acidosis. Now let's move back to the pH. Suppose the pH that was given to you was greater than 7.45. Now forget all about acidosis. You know that this person is suffering from alkalosis because his pH is greater than 7.45. Now, for a person to be suffering from alkalosis, he can have one of the two problems. Either his lungs are making some problem or his kidneys are disturbed. So for a person who is having respiratory alkalosis, you must understand that there is some condition in which his lungs are not blowing, they are blowing off too much carbon dioxide. Let me repeat. In case of respiratory alkalosis, the person is blowing off too much carbon dioxide into the air and very little carbon dioxide is left behind in the blood, which converts into very little amount of carbonic acid, and this reduced amount of carbonic acid is going to lead to alkalosis, and this is known as respiratory alkalosis. And it can be seen in people who are hysterical or having a psychotic breakdown, and such people start to hyperventilate, and when a person hyperventilates, he blows off a lot of carbon dioxide and not enough carbon dioxide is left behind in the blood to cause sufficient to make sufficient amount of carbonic acid and to overcome to balance out the bicarb ions in your body. So this leads to respiratory alkalosis. So in such a person, you are going to see that the value of partial pressure of carbon dioxide is going to be very reduced, even less than 35 millimeter mercury. Why? Because this person has blown off all the carbon dioxide. if the cause is not respiratory, a person can have metabolic alkalosis too. The reason for metabolic alkalosis is that a person has either secreted too much of his hydrogen ions in his urine, either due to a hormone or a diuretic, or probably too much aldosterone in his blood, or this person has either ingested too much alkaline substance, and because of that his bicarb concentration is going to be very high. It is going to be greater than 28 milliequivalents per liter. So what two conditions we have in alkalosis? If it is respiratory alkalosis, the partial pressure of carbon dioxide will be decreased, and if it is metabolic alkalosis, his bicarb concentration must be very high, so high that it is even greater than hydrogen ions and is causing alkalosis. Do you understand? Now let us see how our flow chart is going to help us in diagnosis. So once you have determined that the patient is suffering from alkalosis, forget all about acidosis and immediately go for the values that are given to you next after the pH. First, if you look at the bicarbs, if the bicarbs are increased, you will immediately understand this person is suffering from metabolic alkalosis. But if the bicarbs are either normal or slightly decreased, rule out metabolic alkalosis immediately. And when you rule out metabolic alkalosis, the only option that is left behind is respiratory alkalosis. And to confirm your answer, you can look at the partial pressure of carbon dioxide and you will immediately see that the partial pressure of carbon dioxide is very reduced, and you will understand that the lungs are not blowing off enough, that the lungs have blown off a lot of carbon dioxide due to hyperventilation, and there is very reduced partial pressure of carbon dioxide in your blood, which is not adequate enough to form enough carbonic acid. So this is how you make diagnosis of either acidosis or alkalosis, and which type of acidosis the person is suffering from, by looking at the values of partial pressure of carbon dioxide and the concentration of bicarb in the blood. After this step, you are 2 out of 3 done with your answer. You know this is metabolic or respiratory acidosis or alkalosis. What now you need to find out is whether it is compensated or not. So without this third part, your answer is incomplete and you won't be given full marks. So you need to tell what kind of acidosis or alkalosis it is and whether it is compensated or not. So let us look at all of the scenarios one by one and how to see if they are compensated or not. So first let us look at the metabolic acidosis. So metabolic acidosis, in metabolic acidosis you will have pH less than 7.35 and you will have a bicarb concentration less than 22 millimeter mercury, 22 equivalents per liter, and when the problem lies with the kidneys, the compensation is being done by the lungs. So how are lungs going to compensate for metabolic acidosis? Lungs can help by blowing off so much carbon dioxide that not enough carbon dioxide is left in the blood to form carbonic acid. In this way, the acidosis which is being generated or which is being produced by the kidneys is being counterbalanced by the lungs. With the help of respiratory compensation, we can blow off enough carbon dioxide to reduce carbonic acid in the blood to balance out the the effects of metabolic acidosis. And how can you see if there is any compensation taking place or not? So when you have determined that the person is suffering from acidosis, and the acidosis is because of decreased bicarbs, then you have to look at the partial pressure of carbon dioxide. If the partial pressure of carbon dioxide is also reduced, immediately understand that the lungs are compensating. But if the partial pressure of carbon dioxide is not reduced and it is normal, then you will say that the lungs are not compensating for this metabolic acidosis. Let me repeat. Once you have determined that the person is suffering from acidosis and the cause of acidosis is metabolic and renal because of decreased bicarb ions, then immediately look at the value of partial pressure of carbon dioxide that has been given to you. If the partial pressure of carbon dioxide is reduced, then you can understand that yes, the lungs are compensating, and you can say that the person is suffering from compensated metabolic acidosis. But if you see that the partial pressure of carbon dioxide is either normal and it is not reduced, then you are going to say that the lungs are not compensating and the person is suffering from uncompensated or non-compensated metabolic acidosis. Now let us move on to the next scenario in which the person is suffering from respiratory acidosis. So what you determined was that the patient had a pH of less than 7.35. His carbon dioxide levels were very high, which meant his lungs were not working properly, and he was retaining carbon dioxide, which increased his partial pressure of carbon dioxide in his blood and led to respiratory acidosis. So when the lungs are disturbed, who is going to compensate? The kidneys are going to compensate. And how can kidneys compensate for acidosis? They can compensate by increasing bicarb in the blood. So if the bicarb value which is given to you is greater than normal, then you can say that this person is compensating for his respiratory acidosis, and such person will be labeled as compensated respiratory acidosis, that his kidneys are compensating for his respiratory acidosis. But unfortunately, if the person has a normal value of bicarbs in his blood, then you have to immediately understand that there is no compensation being done, no renal compensation being done for his respiratory acidosis, and you are going to say that this person is suffering from uncompensated respiratory acidosis. Now let us move on to alkalosis. Suppose a person is suffering from metabolic alkalosis. This means his kidneys are at fault, and his hydrogen ions are being secreted into the urine at a very high level and very high number, and this has led to accumulation of a lot of bicarb ions in his blood, which has led to metabolic alkalosis, as can be seen by very high levels of bicarb ions in his blood. So when the kidneys are at fault, who is going to compensate? The lungs are going to compensate. And how can lungs compensate for alkalosis? The lungs can compensate for alkalosis by retaining carbon dioxide. So if the value of partial pressure of carbon dioxide that has been given to you is greater than 45 millimeter mercury, you will immediately understand that this person is suffering from compensated metabolic alkalosis, because he had metabolic alkalosis and his lungs are now retaining carbon dioxide to combat that alkalosis and to balance out that alkalosis. So this person will have very high values of partial pressure of carbon dioxide and is said to be suffering from compensated metabolic alkalosis. But if the partial pressure is normal, then we can say that there is no compensation being done. Next, we come to respiratory alkalosis, and as I mentioned before, that when a person is suffering from hysteria and is hyperventilating, this person is going to blow off a lot of carbon dioxide, and the carbon dioxide which is left behind is very little and its partial pressure is reduced. You will immediately understand that the person is suffering from respiratory alkalosis. So where is the fault lying? The fault is lying with the lungs. And who is going to compensate? The kidneys are going to compensate. How can kidneys compensate for respiratory alkalosis? The kidneys can compensate for respiratory alkalosis by throwing out a lot of bicarbs in the blood and reducing the levels of bicarb in the blood. So what you are going to see in a person who is having compensated respiratory alkalosis, his bicarb levels are going to be less than 22 equivalents per liter, and then you can say that the person is suffering from compensated compensated respiratory alkalosis. But if his bicarb levels are in a normal range, then immediately understand that this person is suffering from uncompensated respiratory alkalosis. So I hope you understood how to diagnose acid-base disturbances from a scenario. This is going to take some practice, so please do not hesitate to practice some questions from past papers so that you can understand how to calculate and how to determine what kind of acid-base disturbance a person is suffering from. And you have to be very apt in your calculation, because you might also be given these questions in your MCQs and you might not have a lot of time, so you need to practice a lot so that you can immediately determine what kind of acid-base balance the person is suffering from. So I have a scenario over here. Let us solve this together. And I have deliberately not given any hint in this question so as to see if we can determine the disorder without any helps or hints or cues, just relying on the values that are being provided to us. So here we have the pH, which is 7.25. They say a patient is suffering from some disease and he has a pH of 7.25. What does this tell you? We have to fill 3 blanks. So this tells us that it is acidosis. What it tells us? It tells us that this is acidosis. Why? Because the pH is less than 7.35. Now we need to determine whether it is respiratory acidosis or metabolic acidosis. So before we look at the values that are being given to us, let's make a map in our brain at what should we expect. If the person is suffering from respiratory acidosis, then he should have increased partial pressure of carbon dioxide. Is it so? And if the person is suffering from metabolic acidosis, then this person should have decreased bicarb values. Isn't it? Now let us look at our scenario. This person has bicarb which is very large in value, and it is 60 equivalents per liter. Normal bicarb values are around 22 to 28 equivalents per liter, but the value of bicarb in this patient are very high, so we can immediately rule out metabolic acidosis, isn't it? Now the only option which is left behind is respiratory acidosis. Now let us look at the value of partial pressure of carbon dioxide that is given to us. The partial pressure of carbon dioxide that is given to us is 60 millimeter mercury, and we know that the normal value of carbon dioxide, partial pressure of carbon dioxide, is 35 to 45 millimeter mercury, and this value is very high, so we can assure ourselves that our diagnosis is correct and this person is suffering from respiratory acidosis. So now we are done with 2 out of 3 parts of our diagnosis. Now we have to see either it is compensated or not. So when the lungs are at fault, who is going to compensate? Our kidneys are going to compensate. And how are they going to compensate for acidosis? To combat or to balance acidosis, they need to retain bicarb. And when you retain bicarb, your value of bicarb concentration in your blood should be high. Now let us look at the value of bicarb that is given to us. It is 60 equivalents per liter, and we know that the normal value for bicarb is around 22 to 28 equivalents per liter, and this value is very high, which means that it is compensated. So you can complete your answer by saying that the person is suffering from compensated respiratory acidosis. So these values are all made up. I just wrote down these values from the top of my head, and these might not be clinically correct or clinically possible, but I just gave very stark or very huge values for you to understand. So this is how you diagnose an acid base disturbance. So I hope you understood this concept, and this is going to be very helpful for you not only in your exams, physiology exams, but also they are going to help you in medicine and throughout your life to diagnose any kind of acid base imbalance, which is very, very important and even life saving. So let us now discuss the effect of acidosis and alkalosis on body. So in acidosis, there is CNS depression because of reduced synaptic transmission, and this leads to coma, and which may even lead to death if left untreated. On the other hand, alkalosis increases the synaptic transmission, and it causes CNS overexcitability. So metabolic acidosis and alkalosis are compensated by respiratory mechanisms, as we have already discussed, and vice versa. So treatment for acidosis is ingestion or IV injections of sodium bicarbonate, and the treatment for alkalosis is by ingestion or IV injections of ammonium chloride. So these are just some MCQ nuggets for you. These are going to help you in solve your MCQs. Next, we have another interesting topic which is known as anine gap. So, you must remember that the concentration of positive ions in your body or in your blood is equal to the concentration of negative ions, and this is very, very important to maintain the electrical neutrality of your plasma. So, the positive ions in your plasma are always equal to your negative ions, and the positive ions are known as cations and negative ions are known as anions, and there should be no anine gap in plasma. What does this mean? That suppose if we divide your ions into two halves, on one side we have positive ions and on the other side we have negative ions, your positive ions and your negative ions should be exactly equal, and there should be no reduction in your negative ions in a healthy individual. But if there is any reduction in negative ions as compared to positive ions, this is known as anine gap, and in a normal healthy person no anine gap is present, but in some cases such as metabolic acidosis there can be present an anine gap. So let us determine what is meant by anine gap and how it helps you in determining different types of diseases and disorders. So normally you must understand that the positive ions which are measured in your plasma are mostly sodium and potassium, and as you already know that potassium is in very, very, very minute negligible quantities in your plasma, so we can ignore plasma right now, and we can say that the major cation or positive ion present in your plasma is sodium. On the other hand, the negative ions or anions which we usually measure in plasma are chloride and bicarb ions. So according to our calculation, our sodium ions must be equal to chloride ions plus our bicarb ions. but studies have showed that they are not equal. Our sodium ions are way more in number than our chloride and bicarb ions combined together. And we also know that there must be electrical neutrality in our plasma. So this logic tells us that there must be some negatively charged anions present in plasma, which are not usually measured while taking blood samples. So these unmeasured ions are responsible for anion gap. Now let us see how these anions are responsible for causing anion gap. Anion gap is the difference between unmeasured anions and unmeasured cations. And these unmeasured anions include either phosphate, citrate, sulfate, negatively charged proteins, or even lactic acid. Now let us discuss this with the help of a diagram. So as I mentioned before, in this figure you can see that the total number of positive ions must equal to the total number of negative ions. But the positive ions which are calculated are only sodium, and negative ions which are calculated are chloride and bicarb. So this means that sodium must be equal to bicarb plus chloride. But when this was conducted, it was seen that the concentration of sodium was greater than the sum of bicarb and chloride, which led to believe that there are some unmeasured organic acids which are also present in the plasma, and they constituted the anion gap. So how does anion gap help us in measuring different types of acidosis? Remember that in metabolic acidosis there are two conditions which may occur. Either in metabolic acidosis there can be reduced bicarbs, or there can be increased hydrogen ions. Both of these conditions can lead to metabolic acidosis. So when the reason for metabolic acidosis is reduced bicarbs, remember that the kidneys always start to compensate this bicarb loss by trying to reabsorb chloride. So whenever metabolic acidosis is due to decreased bicarbs, the concentration of chloride is going to increase, and the value of calculated or measured anions is going to remain the same, and the anion gap is going to remain the same. So when there is present metabolic acidosis without increase in anion gap, you immediately understand that it is due to reduced bicarbs, which have been compensated by increasing chlorides, so that the anion gap is not increased. And this is how you determine whether the metabolic acidosis is due to reduced bicarbs or increased hydrogen ions of organic acid. The second condition is which in the body is producing large quantities of acids and hydrogen ions, and this is when there is lactic acidosis or increased citrates or increased sulfates in your body, and that is when your anion gap is going to increase. What happens is when your unmeasured anions start to increase, especially when there is increased lactic acid, this lactic acid is going to release hydrogen ions, which are going to neutralize your bicarb ions, and your bicarb concentration is going to reduce, and your anion gap is going to increase. And when your anion gap is increased, this means that the acidosis is not due to primarily reduced bicarbs, but it is because of increased hydrogen ions, which can be due to increased lactic acid formation or due to increased sulfuric acid or other kind of acids. So this is how your anion gap helps you in determining the cause of metabolic acidosis. So let me repeat. that acidosis can be of two types. Metabolic acidosis can be of two types or due to two causes, one in which the A9 gap is increased and the other one in which A9 gap is not increased. And the causes can be because of decreased bicarb or because of increased hydrogen ions. Now, how can you determine if the metabolic acidosis is because of excretion of bicarbs in the urine, or is it because of increased acids in your body? So, to determine this, you can do a simple calculation. Whenever your A9 gap is normal, this means that the acidosis is because of reduced bicarb ions. Now, how does that happen? When your kidney is damaged and it is losing a lot of bicarb ions in the urine, your bicarb concentration is going to be reduced, but it is compensated by the kidney by reabsorbing a lot of chloride. So when this bicarb decreases and the chloride increases, the total number of measured anions remains same, and your anions gap also remains same. And when the A9 gap is normal, you immediately understand that there is reduction of bicarb which is being compensated by the chloride. But on the other hand, if you have ingested some acid, or if you have your body is producing large quantities of lactic acids which are a part of your unmeasured anions, what happens is a lot of this acid is being produced, and also this acid is going to go and neutralize your bicarb, because hydrogen ions which are being produced by the acid are going to combine with the bicarb and reduce the total concentration of bicarb and increase the concentration of unmeasured ions such as lactic acid or citric acid. And now you can see that this A9 gap is increased, which is going to tell you that the acidosis was due to increased organic acids and increased hydrogen ions, which have neutralized or which have reduced your bicarb ions. And this is how A9 gap can help in determining what is the cause of metabolic acidosis. So this is an interesting concept. It is a bit difficult to understand, but for BDS students, you are not going to be asked about the calculation of A9 gap. You can only be asked about the definition of A9 gap and what are the ions which are being measured, and what is the value of A9 gap. Remember that a normal A9 gap is of around 10, and when this values exceeds 10, only then you can say that the A9 gap has been increased. So for BDS students, all you need to know is the definition of A9 gap and what are the ions that are involved. The cations that are involved are sodium, and the anions that are involved are chloride and bicarb, which are the measured anions, and then we have the unmeasured anions which constitute the A9 gap. That is all you need to know, and this is all that is going to be asked of you in your vivas and your written exams. So with this, we have come to an end of the chapter of renal physiology. I hope you have understood all of these concepts. It is a bit of a difficult unit, so if you have any questions, please leave them in the comment box, and I hope you understood most of this lecture. So best of luck, and this is all from the renal physiology.